People who live in Island House smoke more cigarettes than anyone in BC. Not just that, but they drink more alcohol than the rest of the province too. A new report by Island House Chief Medical Officer is calling for action to address the harms from psychoactive substances, not just drugs, but alcohol and cigarettes too. Dr. Rika Gustafson admitting the report may prove controversial, particularly to those who drink.
I think the important point is that these substances are harmful, but we can do something about them. We have to decide we want to and recognize that it takes perseverance and using the evidence-based interventions that we have available.
The Island Health Substance Report determined the highest hospital admissions within Island Health are due to alcohol, followed by opioids, stimulants, and cannabis.
There's no big secret here. There's no, but it's very clear that if we consume more alcohol, we have more harms related to alcohol. And the very close relationship between the things we do to increase alcohol access, consumption, and then the subsequent harms.
And tobacco kills more people than alcohol and opioids, with 51 deaths per 100,000. There is a glimmer of good news in the data, though. Far fewer young people are drinking alcohol compared to 32 years ago. Nationally, 14% of Canadians smoke. In BC, that number drops to 11%, but increases to 16% on North Vancouver Island, 13% on the Central Island, and 11% on the South Island.
Probably the biggest surprise for me was that tobacco consumption actually increased in the North Island over the last 5-year period.
With the ongoing toxic drug crisis, it may not be surprising that illicit drugs continue to be the #1 killer of young adults, followed by suicide and accidents. Island House opioids deaths are the second highest in BC. The report's recommendations include establishing access to a strictly regulated, safe supply of opioid and stimulant drugs for those at greatest risk of overdose, and increasing prevention programs for youth and young adults.